The Omicron variant is taking hold across the nation and believed to be behind the surge in cases right here in the St. Louis region. Local hospitals are reporting the highest COVID-19 hospitalizations in nearly a year. But Russell Kinsall found it's not easy to get tested. He's live in the Central West End with that tonight. Russell.
Sam, whether you're feeling sick or you've been around somebody who tested positive, you really need to get a test to know for sure whether or not you've got the virus. But the demand is so high, getting tested is a real challenge.
I'm coming to get tested because my cousin tested positive over Christmas.
For Ramona Bass, it was a family Christmas gathering that prompted her to get tested. She came to the St. Louis County North Central Health Center, one of 3 county testing sites, which are now by appointment only.
But I haven't had no symptoms or anything just yet. But I wants to make sure because I be around my grandkids, I have a lot of those, and my family.
The 2 CARE STL health clinics in St. Louis were some of the only places where you could walk up without an appointment. But they ran out of supplies by noon and have been hit with their own COVID surge.
Our organization has been hit hard, where a lot of our employees actually came back positive.
There are no shortages of testing supplies at Total Access Urgent Care Centers. There are 21 locations doing COVID testing for people with symptoms. You'll need to go online to get on a wait list, but can get in the same day or next.
We've worked very hard on making sure that we have the relationships with the manufacturers and various redundancies.
Dr. Dinkle says 3 other locations do testing for people without symptoms, but by appointment only. A small number of tests are sent out to local labs, but they have seen a slight slowdown.
There's been so much testing on the East Coast, especially in the New York area, given their massive prevalence of Omicron, that those tests are being sent throughout the country, including to St. Louis, which is causing some of our send-out testing to be slowed down a little bit.
The national shortage of healthcare workers is impacting their ability to do even more testing, and the fact that even healthcare workers sometimes can't escape the highly contagious Omicron variant.
Our teams are contracting COVID. I mean, they're heroically in the middle of this all the time, and so we have more people, out on isolation than at any point in the pandemic.
Healthcare professionals I talked to today said that Omicron variant is just so contagious. They really stress the steps that you need to take to protect yourself. That is, get vaccinated, get a booster shot, wear a mask, and use social distancing. Live in the Central West End, Russell Kinsall, News 4.
Russell, thank you.